ECP is a new method of treatment with a machine which increases the blood flow to the heart, the kidneys, the brain and the rest of the body. It has been successfully used to treat angina. Who have angina can benefit from ECP. ECP can be used for those patients who have got heart disease, who do not want bypass surgery, or who cannot afford bypass surgery, or who are unfit for bypass surgery. It is also useful for those patients who do not benefit with medicines. ECP has been extensively used for patients who have had a recurrence of angina after bypass surgery. After ECP, the patient's angina decreases and he requires less medicines. His requirement of sorbitrate as and when he has pain is decreased. It has been seen that patients of angina who have had ECP, their blood flow has increased when tested with either stress thallium or with RGCI. In ECP, cuffs are tied on the legs and the buttocks. These, with the machine, are synchronously compressed and they increase the blood flow in the heart during diastole, that is when the heart is relaxing. When the pressure is repeatedly increased in the heart's blood vessels, a few things happen. The first thing to happen is dilatation of the blood vessels of the heart. Next is opening up of those blood vessels which were there from birth but did not open up, that is dormant blood vessels. The pressure in the arteries gives stimulus to the secretion of vasoendothelial growth factor, which stimulates the formation of new blood vessels, that is angiogenesis. Thus, patient has relief from angina, and because the new blood vessels are formed, the effect is long lasting. It has been seen that in most patients, the effect of ECP lasts for 3 to 7 years or more. In ECP, the treatment is given in shifts of 1 hour. A patient requires 35 sittings of 1 hour. A patient can be given 1 or 2 sittings a day. If a patient has 1 sitting a day, 6 days a week, the total treatment will take around 6 weeks. And if he has 2 sittings a day for 6 days a week, the treatment will take 3 weeks. Hence, depending on if a patient takes 1 or 2 sittings a day, the treatment will last 3 or 6 weeks. The advantages of ECP are that it is simple, safe, effective, and with a very large success rate and effects which last for many years. It is non-invasive, requiring no surgery, no anesthesia, no medicines, and no hospital stay. It is compared to natural bypass. The treatment is absolutely safe. It is comfortable to the patient. The treatment is absolutely painless. To look at, it may seem that the patient is getting a lot of jerks, but it is more to the person who sees than the patient who is being treated. No patient has dropped out of the treatment due to any discomfort. In fact, the treatment is so comfortable that some patients listen to music and some patients may even have a small nap during the treatment. Yes, ECP is possible after angioplasty and bypass. In fact, in the United States, the first research was done when bypass failed on the patients. They were treated with ECP with excellent results. And now, ECP is FDA approved for angina, for myocardial infarction, for cardiogenic shock, and research is going on for use of ECP for congestive cardiac failure. In China, ECP is also being used for kidney diseases and for improving the circulation in the brain. The initial machines of ECP were also used for increasing circulation in the hands and the legs. most patients start feeling better between 15 to 20 sittings. Because each individual is different, each person's disease may be of a different extent. There is no definite time when we can say when a patient will improve. But most patients improve between 15 to 20 sittings. It has been seen in the United States that the insurance claims for health for ECP have gone up by 6% in the last couple of years, whereas that for bypass surgery and angioplasty have gone down by 7%. If we see this as a trend, I visualize that in the near future, ECP is going to go up higher and higher, higher and higher. And the other invasive treatments are likely to diminish in the same proportion.